I'm going to talk to you all today about healthcare. And healthcare obviously is something that is, we're right around a election, and healthcare is something central to everybody's concern in many ways. But I'm going to talk about it a little differently than probably how you think about it most of the time. You know, we think about healthcare, we think about insurance, which is obviously important. We think about getting our flu shot, which is important. We think about getting our annual checkup, which is important. You should do all those things. But I'm going to talk about what's known as the social determinants of health. And I'm going to get into that in a little bit greater detail in a second. But when I start, I want you to think about healthcare as a civil right. And once again, that's something we hear about a lot, especially around election time, is healthcare a civil right or not? What I'm going to talk about right now is that healthcare, and we don't think of it very much, was part of the civil rights movement. And healthcare came directly out of the civil rights movement in many ways, our current healthcare systems. Dr. King talked about healthcare. We don't think, once again, about healthcare in the civil rights movement. We think about voting rights, we think about desegregation, we think about schools. But healthcare was very central to what a lot of the civil rights leaders were talking about. Dr. King talked about it, Malcolm X talked about it, Fannie Lou Hamer talked about it, the Black Panthers created healthcare clinics in Oakland and in many places. So healthcare was very central to the message of what was important to civil rights. And so, this is not a new thing when we talk about healthcare being viewed as a civil right. And during the civil rights movement, there was a group of physicians, black and white, northern and southern. There's a group called the Medical Committee for Human Rights. And what they did is they traveled throughout the South, mainly in Mississippi and Alabama, 1962, 1963, 1964, 1965, and they patched up the civil rights workers. You've all seen images of civil rights workers getting beaten up. Well, doctors didn't treat them in the South. Hospitals didn't take them in. We didn't have a Good Samaritan law back in the 1960s, so they were not treated. So this group of doctors traveled around the South, patched them up, took care of these civil rights workers. But what happened as they were doing this, as they were traveling throughout the South and they were patching up these civil rights workers, they got very frustrated. They saw the good work that these civil rights workers were doing. They saw that they were fighting for desegregation, fighting for voting rights, all the things that we think of when we think of the civil rights movement. But they also saw the deplorable conditions that the black community and a lot of the white community in the South was living in. And these doctors literally sat around at night in the hotel rooms. They were saying, what are we doing? What is this fight for if people don't have enough to eat, if people don't have any adequate health care, if people are living in conditions that are unhealthy? And so they started to think about what could they do. And the father of this movement is a guy by the name of Dr. H. Jack Geiger. And Jack Geiger was one of these physicians, one of the members of the Medical Committee on Human Rights. And Jack said, we've got to think about not just treating people, not just trying to make them better when they get sick, but alleviate the conditions that make them sick. And so he talked about the social determinants of health. What are the things that make people sick? And what can we do to alleviate them? Because what he saw were conditions as he traveled throughout the South that were making it a situation that people couldn't get better. He said, our job isn't just to get people better when they get sick, but to prevent them from getting sick in the first place. And so he first, with some of these other doctors, started a small clinic outside of Jackson, Mississippi. They basically did that out of their own back pockets. They said, that's inadequate, that's not enough. So then they went and they wrote a grant. This is during the Great Society and the War on Poverty. And they got a demonstration grant to start the first 2 community health centers in the United States, one in Mississippi and one in Boston. And we now have 2,900 community health centers in the United States. It's the single largest way that people get health care in this country. 27 million, I think, people now get health care through the community health center. And it comes right out of the civil rights movement. And one of the things that Jack wanted to do was deal with the problems at the grassroots level. And the first one he dealt with was poverty. And when he was in Mississippi, he set up the first community health center in the South in Mound Bayou, Mississippi, and dealt with basically sharecroppers in North Bolivar County. And he dealt with conditions like this. And this picture is very powerful. It's also very illustrative. Because one of the things that when Geiger set up his first community health center in Mississippi, he knew statistics. He knew that maternal and infant mortality rates in Mississippi were terrible in 1966, 1967, 1968. So he recruited pediatricians, he recruited people to come down and do these things. But what he found out was that there were other problems he had to deal with. And like I said, this picture is very illustrative. This is if you can see, this is a stove. This is a sharecropper shack, and it's a stove. It's a stove made out of a 55-gallon drum that was left on the plantation. That was the only source of heat. The first winter the health center was open, they had all these small children that were coming in with burns, and they weren't ready for burns in Mississippi. Why are we getting all these burns in Mississippi? And it turns out that this is how most houses were heated. And so kids were running into it. So they went out, they said, we can't just wait for people to come to the health center, we got to get out into the homes. And so they started building little fences around the stoves. That eliminates a problem, right? But then they said there's a lot of other problems. The roofs leaked. We got this quote from Dr. Brown, right? It doesn't do any good to treat someone and send them back into an environment when they're going to get sick. There were no screens on the windows. People were getting diseases from mosquitoes. There were holes in the floorboards. There were snakes. There were rats that were getting in. So they set up a system just to fix up the houses, right? Because poverty has a tremendous impact on someone's health. And there are obviously lots of reasons, many of which we don't have time to go into, but this is just kind of an example. And so this is the 1960s, but today, of course, we still deal with poverty, and poverty still has a huge impact on people's health. A recent UN report on poverty in the United States, saw Alabama as the most impoverished areas in the country, Lowndes County, Alabama, and we're going to look at some pictures in a minute, where people are dealing with some of the same conditions that Jack Geiger saw a half a century ago in the Mississippi Delta. And if you live in extreme poverty, it has direct effects on your health. It has effects on, obviously, if you can afford health care. We live in a state where with Medicaid, obviously people say, well, we have Medicaid in this country. Well, if you make more than 18% of the poverty rate in Alabama, you don't qualify for Medicaid. So if you make more than $4,000 a year in Alabama, you're too rich for Medicaid. So part of this is policy, right? Part of this is policy. We need to change policy. So you deal with those types of issues, but poverty today still has a direct result on health. One of these issues that Geiger saw, and we're saying it's still relevant today, is sanitation. Right? One of the things that was horrifying to him when he went into Mississippi and his sanitary engineer was that there were towns where the white side of town was sewered and the black side of town was not. Those sharecropper shacks we saw didn't have toilets. They had sunshine privies, open privies, and they actually got to a point, this is the late 1960s, that they were building outhouses, building sanitary outhouses, because that was a better solution than what they had. And it was horrifying to them that they were saying, look, why are we having to build outhouses? We should be building sewers, but they didn't have the money to do that. So they're building outhouses because up to that point, when you had rain in cities like Rosewood and Alligator, Mississippi, there would literally be human waste in the black part of town. Eventually, that led to Supreme Court cases, Shaw versus the United States. Once again, we don't think of sanitation, we don't think of sewage as being a civil rights issue. There were boycotts, there were court cases, and Shaw versus Mississippi, which was finally decided in the early 1970s, says yes, a municipality can't decide to provide basic services to one part of town and not another part of town. And so, that was a struggle that was won in the 1960s. But we've also seen deterioration of a lot of these situations. This is Lowndes County, Alabama, 2018. There's sewage in the streets, sewage bubbling up because that infrastructure has gone out of working order and has not been replaced. So this UN report on poverty issued a devastating indictment of a lot of aspects of poverty in the United States. And if you haven't had a chance to read this, you can Google it. It's not that long, but it's very devastating. And talking about the raw sewage that's found in parts of Alabama and parts of West Virginia. Also looked at Puerto Rico and the problems there. And the fact that this is creating situations that health conditions that had gone away are coming back. One of the most devastating is hookworm. Hookworm is a parasite. It's something that had basically been eradicated by the 1940s and 1950s in the United States, because if you have sewage systems, you don't get hookworm. It's coming back, and it's a parasite that's now being found again in humans in Alabama and Mississippi because of the problems we have. So sanitation, basic things that pretty much everybody in here, I assume, takes for granted, that we have toilets. These are issues that are affecting health of our neighbors still today. Related to sanitation, of course, is water. There's another picture from the 1960s. We see another one of these drums. You can see there's a little spigot on it. I always think this is a powerful photo. Those shacks that Dr. Geiger came across in the 1960s, they didn't have sewers, they didn't have running water either. And so what many people would do, they would get these old 55-gallon drums from the plantation, and they would take them into the city, the municipal water supply, and they'd fill them up. Of course, these drums had previously held DDT and other chemicals on the plantation, right? You don't have to be a doctor to figure out that that's not good for your health. So they fought, and they got municipal water supplies built. Once again, the Shaw case dealt with sewers. It also dealt with water. 60 years later, we have Flint. All right? And Flint's not the only city in the United States where we're dealing with water issues. Right? It's become the most famous, but there are lots of places that are dealing with water issues, in part because that infrastructure has broken down, and there's not been the political will to fix it. And if your water's not good, your health's not going to be very good. And like I said, we have Flint. There are cities, Baltimore, New Orleans, where the public schools, kids can't drink the water out of the taps, out of the water fountains, because it's not healthy. It's got too much lead in it. Areas where there's fracking, there's been a lot of problems with the groundwater being contaminated. Coal ash ponds. Like I said, a lot of these issues we hear about only when they kind of intrude upon middle and upper class societies, right? When it just stays with the poor, we don't deal with it. But we're seeing a situation where, with Flint, with the danger of coal ash ponds, especially in North Carolina with the recent hurricanes, the floods, now this water is getting into everybody's drinking water. And then it becomes a crisis. I was in Austin, Texas on Monday, talking about a lot of these same things, and we didn't have water when I was there because of all the flooding. And so Austin was going without water, and so that was causing a crisis there. So water, these are issues that all of us have to deal with, and these are issues that are directly related to health. Right? These social determinants of health. Another thing that Geiger dealt with when he showed up in Mississippi was massive malnutrition. He was horrified, and this is a malnourished baby that he's dealing with the extreme poverty and how that related to people's ability to get proper food. And Mississippi in the late 1960s, the Mississippi Delta, like the Arkansas Delta, like parts of Louisiana, like parts of Alabama, like parts of the Appalachians, many of these areas actually saw hunger getting worse in the late 60s. From the 1930s to the early 1960s, there was what was called a commodities program, a program to deal with taking excess commodities, flour, cheese, wheat, different things, and giving them to the poor. That gets replaced with the food stamp program in the 1960s. The idea behind the food stamp program was, one, it was going to give people more variety. It was also going to be good for business, right? You had to spend the food stamps. But the initial program, you had to buy the food stamps. You had to pay about 22 cents for every dollar. Where Geiger was, the average family made $700 a year. If you make $700 a year, 22 cents to buy a dollar's worth of food was more than you could afford. And he saw nutrition getting worse, malnutrition getting worse in these areas. And so, one of the things he did, he had a federal budget, and he started writing prescriptions for food. He wrote them out of his pharmacy budget. You can imagine when people in Washington found out that he was writing prescriptions to local grocery stores for milk and eggs, they went bananas. They say, you can't do this, prescriptions are for medicine. And he said, the medicine for malnutrition is food. And of course, they couldn't argue with that. And they started setting up a new program where there was going to be a food relief. But of course, that doesn't solve the problem in the long term. That only solved immediate problems. We deal with malnutrition today. We deal with malnutrition in many different ways. 15% of the American population is food insecure. 40 million Americans are food insecure. 6.5 million children are food insecure in this country. And when we talk about malnutrition today, we talk about certainly not having enough to eat, but we also deal with the issue of having the wrong things to eat. One of the physicians that was in the original Delta Health Center, one of Dr. Geiger's colleagues, Aaron Shirley, was a fascinating guy. He was just a hero of the medical community in Mississippi. Dr. Shirley said, in the 1960s, people were dying of not enough to eat. He goes, in the 2000s, they're dying of the wrong things to eat. And we deal with what many of you have probably heard about, things called food deserts, right? Where if you live in an urban area or you live in a rural area, there may be a place to get food, but it's a gas station. And you can't get nutritious food. But it's also an issue of poverty. A 2 liter of Coke costs $1.50. A gallon of milk costs $3.50. People are buying Coke instead of milk for their children. And so malnutrition is another one of these social determinants of health, and something that has not gone away. Right? We do have food assistance, right? And the food stamp program has been adjusted since it was in the 60s, but it is something that you probably all know is constantly under attack, right? Constantly being limited on who can qualify for it. And of course, it's important to remember it's not just people who are unemployed that need food assistance. Most big public universities now have food banks for their students. Half of all children of the armed forces, active armed forces, their children qualify for free or reduced meals. Right? If you work a 40-hour week at minimum wage, you still qualify for food assistance. So all of these issues I just want you to think about as you leave today. Think about health beyond just my health insurance, my flu shot, my yearly visit, but think about all these other social determinants of health. Thank you very much.